Our proposal presentation is on ultrasound guidance and neuraxial anesthesia. My name is Kyle DeLay and my partner is Anthony Bergstrom.
So for the background and significance, neuraxial anesthesia is a viable alternative to general anesthesia in a variety of procedures. Many CRNAs use the landmark technique for neuraxial anesthesia. I would say almost every CRNA would use that at the current time. And research is showing that ultrasound guidance is an effective resource in the identified population.
So for our PICO question, we came up with, in CRNAs at an urban hospital in southeast South Dakota, how does education on landmark identification and ultrasound assistance for neuraxial anesthesia in pregnant, obese, or anatomically difficult patients compared to no education affect CRNA knowledge and intent to implement the use of ultrasound guidance for neuraxial anesthesia in practice?
So for our literature review, the comprehensive lit review examined a few things. One, the usefulness of ultrasound guidance in landmark identification. Two, the effectiveness of ultrasound use in neuraxial anesthesia in the specified population, and if knowledge is increased with the education. So for the keywords we used, we started out with a Google search to kind of identify what we're looking for just to see what we got back. And then once we found some of those terms, including neuraxial anesthesia, spinal anesthesia, ultrasound, ultrasound guidance, sonography, the landmark method, and the vertebral column, to name a few of them, not all of them, we then took those and then bridged them over to CINAHL, Science Direct, and the Cochrane Library for our three main places that we found our research. So for the evidence-based practice model, each Kyle and I used a different theoretical model. I used Betty Newman's systems model, and for her systems model, she identifies that physiologic barriers that make up a patient's normal line of defense can be shifted. So in this target population, these people with challenging anatomy, the obese and pregnant people, their protective buffer of their normal lines of defense can be less effective. So relating to neuraxial blockade, in the landmark identification, they don't have as easy of landmark identification, and in some patients it may be almost impossible. So the external environment stressors, or the needle that we'd be using to do the procedure, is more likely to disrupt the client's basic structure. So we would be implementing ultrasound assistance as a risk reduction factor for primary prevention to maintain the patient's overall health.
For my evidence-based practice model, I chose Rosano Loxton's technological competency as caring in nursing theory. And the basis of this theory is we as nurses should have an authentic intention to know human beings fully as persons and as participants in their care rather than as objects of our care. And the whole basis is each patient has varying situations of care that call for creativity, innovation, and imagination from nurses so that they may come to know the nursed as a whole person. So basically, it's using technology to understand your patient more, and ultrasound guidance and neuraxial anesthesia would help us do that. For our evidence table, we're finding a lot of very good randomized controlled trials. These are just a few that we found so far. So the first article by Chin et al. Was a randomized controlled trial to compare needle movements during a spinal epidural anesthesia with and without ultrasound assistance. And basically that study found that ultrasound assistance was superior to the landmark technique in first pass success in facilitating neuraxial anesthesia. So basically it's just saying it's a lot better to get your first attempt while using ultrasound assistance. The second article was by Park et al., and it was using ultrasound assistance and comparing that to the landmark guided in spinal anesthesia in the elderly. And the results were very similar. It showed that ultrasound assistance increased first pass success, reduced needle manipulation or having to redirect your needle, and reduced patient discomfort. And the final article that we found so far is by Akinci et al. And this was comparing ultrasound assistance in planned cesarean deliveries under spinal anesthesia for patients that had non-prominent anatomical landmarks. And the results of that study showed ultrasound assistance decreased needle punctures and increased first pass success in neuraxial anesthesia. All of our articles so far that we found using the Johns Hopkins Nursing Evidence-Based Practice Model showed a level 1 in quality A, meaning that they were randomized controlled trials and the quality was high. They all had adequate number of participants. The studies were pretty sound. It was pretty cut and dry, and the results seemed to be useful. And basically what we're finding is that all of these show first pass success is increased. The time for the procedure takes longer because you have to use the ultrasound to find your needle placement. But overall, it seems to increase success in these patients that have a difficult anatomical landmark. They have difficult anatomical landmarks.
So for our project purpose, the purpose of it is to educate CRNAs in urban southeastern South Dakota on the use of and indications of ultrasound assistance in neuraxial block placement. So to complete this, we'd be providing education to CRNAs on these indications and the uses, including the technique of ultrasound guidance. And following education, we would administer a test to evaluate the effectiveness. So that kind of bridges into our proposed interventions. So we would want to do a pre-test to adequately assess the knowledge of ultrasound use for this neuraxial block placement. The education that we would provide would be on indications, the target population that this may be more favorable in, and then the overall technique that you would use to identify the landmarks. And then one thing to add about this, it's not ultrasound, the needle isn't visualized under ultrasound. The ultrasound is specifically used to identify landmarks, just to give you a target of where to start your block. It's not like regional blockade where you're visualizing your needle as you're injecting local anesthetic. So that is a little bit different. And then after the education, we would use the post-test to assess their knowledge and if they would possibly use that after learning about it.
So bridging that into our proposed outcomes, we want an increased knowledge on the indication and use of ultrasound guidance for administration of neuraxial anesthesia in CRNAs in southeastern South Dakota. The basic premise of this is we know that not every patient needs this ultrasound guidance, but we just want CRNAs to have the education that this is available if the patient population demands it. And we know it'll add time, but in the end, one puncture is always better than multiple punctures. And we hope that this education will at least just add another tool in their tool bag for anesthesia, neuraxial anesthesia. And that is our proposal. Thanks.